All right, so in this video, we're going to talk a little bit about hip rotation. Now, rotation is really critical because being a ball and socket joint, rotation is an absolutely fundamental motion of the hip. In other words, if the hip doesn't rotate the way it's supposed to, this is really going to come out in terms of generating some abnormal hip motion with functional activities, things like squats and lunges, even walking and running. And the other reason this is really important is rotation tends to be one of those neglected areas. It often gets forgotten about, right? So when we're training the hip, we often think about stretching the hip flexors and the hamstrings to create that front to back motion. And as important as that is, like we said, rotation is really a key motion that we need to make sure is working and moving the way it's supposed to. So this is going to be a bit of a crash course in hip rotation. We're going to start by going over some fundamental assessment procedures that I often do in my office to see if in fact the hip is rotating the way it needs to. And then we're going to go over some key stretches and exercises that I will often prescribe to help improve the ability of the hip to rotate if in fact we find some problems here. Now keep in mind that when we talk about rotation, there's really two directions, right? There's internal and there's external rotation. Now just for the sake of simplicity, we're going to keep this first video focused on internal rotation, and then I will do a part 2 follow-up where we go over some of these key things and key procedures to help train and improve hip external rotation if we find that is the area that we need to work on. So with that being said, let's take a look at some of these assessment procedures that we can utilize to see if the hip is in fact rotating the way it needs to. All right, so let's take a look at some assessment procedures for hip rotation. Here we can just use our model here just to show you what's happening during the assessment. So we can start with our patient or client prone here, and we're simply just going to bend the knee so the lower leg is vertical. And then from here, we can simply rotate that lower leg outwards as far as it'll go within comfort, and then rotate that lower leg inwards. As lower leg goes outwards, we can see how the thigh here and the hip is rotating internally. Likewise towards us is creating external rotation of the hip. So we're simply going to just rotate that back and forth, making a note of how far each of those directions goes. Now, of course, everybody wants to know how far is this supposed to go? And this does tend to be a little bit of a tricky question. What we will say is, in general, we should have about a 90-degree arc of internal and external rotation. But some of this, in terms of how much this goes, is going to be heavily influenced by the bony anatomy of your hip, especially how the angle of this neck of the femur forms. And so what we generally will see is it forms in such a way where we have a little bit more external rotation, right? That's a little bit more going inwards compared to outwards. So usually we're going to expect to see maybe about 50 or 60 degrees of external rotation, and then maybe 30 or 40 degrees of internal rotation. All right, but keep in mind the key thing is we should have some pretty free motion in each of those directions. Now the other thing to keep in mind is that this is assessing the hip with the leg in line with the body or in a more neutral position. But remember that hip has to rotate when it's in various degrees of flexion and extension as well. So we don't want to do a measurement just in this position, but we will also want to see how the hip is able to rotate when it's more flexed. And for that, we're going to assess it from a supine position. All right, so now we've got our client or our patient supine. And from this position, again, we're simply going to bend that knee to bring that thigh and that hip into flexion. And then again from there, we're going to rotate lower leg outwards. This is internal rotation of the hip. And again, we're going to rotate inwards towards us. This is external rotation of the hip. And you can see how that back and forth motion is creating that rotation through the hip joint. Again, what we would expect to see, generally speaking, is a little bit more of a bias between external rotation, 40 to 60 degrees. Internal rotation, again, is going to be in that neighborhood of 30 to 40 degrees. All right, so just this back and forth. Now, again, we mentioned how the neck of the femur and the architecture of the bone through that hip is going to be a big influencer. Now, there certainly are tests that you can do and imaging procedures you can do to measure this. But a nice easy thing to keep in mind is, remember what we said before, we want sort of like a 90-degree arc through that hip. And if you find that that is really heavily biased between one way or the other, so say for example, I can get my external rotation way, way in, but I only have a very small amount of internal rotation, right? But we still have close to that 90-degree of arc. Okay, what that's going to mean is maybe that femoral head is really biased towards a retroverted position. Or likewise, if we have a lot of internal rotation, but very minimal external rotation, but again, that arc is approaching that 90 degrees, we can expect that a lot of that bias is because of an anteverted hip. Now, where that's important is that if it's a structural issue that's limiting the hip, we are not going to expect to change structure. And that's going to really limit your expectation on how much rotation you're going to expect to get from a training perspective, right? So just keep that in mind when we're talking about the hip rotating. We care certainly how much it rotates, but we also want to be mindful of why there may be some limitations in there. And again, if it's a structural limitation, we do need to be a little bit careful in terms of how we're approaching that and the expectations of what we're going to, have with changing that, which is going to be not much if it's a structural issue. Now, with that being said, let's take a look at if we do in fact have a restriction in the hip that we want to try to target. Let's go over some key exercises and stretches that we can utilize to do that. All right, so those are some basic assessment procedures. Now let's go over some movements and some exercises that we can use and prescribe to help improve hip rotation. Now, first off, let's just start with some basic mobilizations that we can use to target rotation. So first off, I can just have myself or my client laying on my back. And then from here, I'm simply going to take my leg and I'm just going to rotate my leg externally, hold for a moment, and I'm going to rotate internally. And I'm simply just going to perform this rotational movement back and forth. And the key here is that my whole leg is moving, but I'm really trying to generate that motion from the hip. And this helps to mobilize the hip into rotation. When I go outwards, I'm going to really work on tensing and squeezing the muscles around my hip to get right to that end range. Likewise, I'm going to go internally, really squeeze those muscles, really try to drive that hip right to the end of that rotation. And I can simply perform 10 repetitions back and forth. I'm trying to be really conscious and deliberate to keep that motion in the hip itself, really trying to squeeze those muscles and drive that hip into rotation to try to expand that motion. And as we said during our assessment, we need the hip to rotate not only when it's in that neutral position, but also when it's in a more flexed position. So to target that rotation from a more flexed position, we can do a similar movement or a similar mobilization, but from our hands and knees position. So what I'm going to do here is just have hands and knees, and I'm simply going to rotate my leg and my hip internally. So my foot is going to go out to the side, and then I'm going to pull it externally. I'm trying to pull my foot and my lower leg underneath my body. Now notice here, I'm just keeping a little bit of a bend in my knee so that I'm not banging into my other leg. I'm just trying to create some space in order to allow that hip to rotate. And again, back and forth. I'm trying to keep my thigh nice and vertical and keep that motion in terms of rotation at the hip, really squeezing the muscles going outwards, squeezing the muscles going inwards. One little alternative that you can do is the other thing you can do to get this leg out of the way is instead of my opposite leg being on the ground, I can just simply straighten out that leg. Again, this gets the knee and the lower leg of the opposite side out of the way. I'm just going to rotate inwards, really trying to swing that leg underneath my body, rotate, opposite direction, hip internal rotation, really trying to get that leg out to the side. Again, I'm going to perform 10 slow, deliberate repetitions back and forth, just trying to mobilize that hip into rotation. Now, those mobilizations are really effective, but one of the limitations that we have is because they're more of an active motion, they create some grooving and some motion of that hip in that socket, but you can only move so far. And sometimes in order to improve mobility, we need to get a little bit of assistance to really drive that hip into a little bit of a more of an internally rotated position. So one option that we can use is to use a band or a band assisted movement. So how we do this is I can use that same hands and knees position, but I can have a band around my lower leg here. And that way, again, when I'm pulling inwards into that external rotated position, there's a little bit of resistance in the band, but I want to set this up so that as I go internally, that band helps to pull my hip farther into rotation than I can do on my own. So again, it becomes a little bit of that mobilization, but it's assisted by the band. That band is trying to drive a little bit more motion. Now, the thing to keep in mind here is we don't want the band to do all the work. We want the band to assist. So I'm still really utilizing the muscles around my hip to try to drive it inwards. The band is just there for a little bit, like I said, a little bit of an extra assistance to get that hip just a little bit more into internal rotation than I can do on my own. So again, pulling in against the band, slowly going outwards, really try to drive that hip into internal rotation, but let the band help you. So another option is we can just perform a basic static stretch for hip internal rotation. Static stretches can be really nice because we can just get a little bit more authority through the tissue and through the joint, and we can hold that tension for a little bit longer, and we know that this time under tension can be a big influencer on the tissue and creating flexibility through the joint. Now, this does add a little bit of a challenge with internal rotation because it's often hard to position the body in such a way to get some authority to drive that hip into internal rotation. So one of the options that we can do is from what's called a 90-90 position. So here, if I wanted to stretch out my right hip, I can kind of have my body positioned. So again, I want my hip kind of in line with my body and my lower leg is on the ground. And I just simply have my lead leg in front of here just for support. Now, normally when we think about stretching the hip, we think about movement through the thigh. But in this case, we're going to do the opposite. We're going to utilize a stable position of our thigh and of our lower leg, and we're going to try to create motion through the pelvis. So the idea here is from this position, I'm going to try to rotate back towards my leg. And as I rotate back, essentially what I'm doing here is if my hip is in this position, this rotation through the pelvis is what's creating the motion of the hip into that internal direction. Now, the other thing to keep in mind is the height in which you're holding your trunk is going to be a variable, right? The higher up I go, it's going to create different tension through the inner part of my thigh here, and it's going to position that joint a little bit higher up. Now, there's no set position on which is better, but really what we want to do is go by feel in the hip. So if you're a little bit really high up and you feel that hip is starting to pinch and jam, what we can do is bring our our arm back to get our trunk at a little bit of a less aggressive angle to create a little bit of a space in that hip so we can start the process of rotating backwards. So like I said, from here, we're just going to rotate backwards. And this is a little bit of a funny stretch because it really gets into those deep fibers around the hip and through the joint capsule. So what you're going to often find is you don't feel much, and then it pulls tight very abruptly. That would be a normal and expected sensation, but remember, should be comfortable. We don't want to create any pinching or pain or discomfort through the hip. We want to make sure we're getting more of a stretch and a mobilization through the hip. So again, going backwards. Now, the other thing to keep in mind is how long we're going to hold these stretches. As a general rule, we want to hold the stretch for 30 seconds and we want to perform 3 repetitions on each side. With that being said, there is some indication and some evidence to suggest that holding the stretch for longer, in that upwards of 2+ minutes, can have some additional benefit in terms of stimulating change through the tissue. Right? So oftentimes we want to do our 3 times 30-second holds, but again, some benefit maybe on that last one, we're going to try to hold this for an even greater length of time. Keep in mind, within that time frame, you don't have to be totally stuck in place. You have the green light to shift and move around a little bit to change that tension and to kind of find that comfortable stretch position. We just want to make sure we're keeping some tension through the joint so that clock keeps running. Now, the other thing that we can do from this 90-90 hip internal rotation position is we can also add some contractions or some contract-relax stretches. Again, creating contraction through tissue from that stretch position can be another really powerful way to help influence the tissue and help to create some more motion and stimulus through the joint. So in this case, how we're going to do that is we're in that same 90-90 position. We're rotated back towards that leg. We're creating tension through our hip here. And in order to create contraction, what I'm going to do is I'm going to take my foot and I'm going to start to push and contract my foot down into the floor. And what you should feel when you do this is you feel some muscles around your hip tense and contract. It's almost as if the stretch or tension sensation is replaced by more of a contraction or a contracted sensation around the muscle here. And what we can do is we can ramp that contraction up, so soft at first, but try to build up some higher intensity contraction through the hip. Again, always staying comfortable. And you notice how when I'm pushing down, I haven't moved my body. I'm staying in that static, stretched and lengthened position, but I'm simply adding contraction against that direction. I can hold that contraction 8 to 10 seconds, and I'm going to slowly relax the muscles. Now, what you'll often find is if you give it a moment or two to relax, you'll find that as we've let the contraction go, we don't have that same intense stretch. It feels a little bit looser. And when that's the case, we can try to rotate back just a little bit farther to try to take up that slack in the hip. Now, I'm going to stay relaxed. I'm going to maintain that static stretch for about 10 seconds. When that 10 seconds has elapsed, I'm going to repeat the process. I'm going to start to push that foot down into the floor, build up to a firm but comfortable contraction, hold 8 to 10 seconds, slowly relax. Again, give the tissue a moment to relax, and if possible, I'm going to rotate a little bit farther back into that rotated position. And again, here we're typically going to repeat this stretch statically, contract actively, 10 seconds on, 10 seconds off, maybe for 4 to 5 repetitions to try to get more of an effect through that hip.